Free studies of the world's most advanced treatment for Alzheimer's disease and memory loss are being conducted right here in the D.C. area by Cognition Health USA. CEO and international neuroradiologist Dr. Emer MacSweeney is joining us to discuss the new generation of treatment to stop cognitive decline. This is something that affects so many families around the world every single day. So talk about, is memory loss a normal part of aging? And let's start there.
Memory loss is not a normal feature, or it's not a normal symptom, and it's one of the reasons why people are often diagnosed so late with memory problems by the time they've also developed lots of other cognitive symptoms as well.
Because we often say, oh, I'm just old, I'm getting old, this is what happens.
No, sometimes people can become more anxious due to circumstances, or they may be not concentrating, but short-term memory loss, and in particular the type of memory loss when you're losing details of recent events, losing details of recent conversations, and somebody prompts you and says, you must remember we talked about this the other day, and you just can't recall that conversation. That is definitely 100% not normal.
Tell me, how does the treatments you offer differ from what people may be getting from treatments from their doctors?
Yeah. So the only treatments that are available sort of through your doctors today in most countries in the world are what we call symptomatic treatments. So these treatments are designed to help the dying brain cells which are being attacked by the abnormal levels of proteins in the brain. It's to help those dying brain cells to work more efficiently. So it's a little bit like drinking coffee when you're tired. It's just a symptomatic treatment. It's not slowing down the underlying disease process. That is progressing relentlessly. The new generation treatments are actually designed to keep those brain cells alive by removing the abnormal proteins or protein-related things in the brain in order to protect those brain cells from dying in the first place.
So what symptoms of memory loss do people need to be aware of?
Firstly, just to say that Alzheimer's, as we get older, is by far and away the most common cause of memory loss. So the key things we need to look out for are short-term memory loss, long-term memory completely preserved quite normally. Within short-term memory, it's in particular finding you're having to make lists for everything, finding that you're forgetting details of recent events and conversations, finding that when you read a book you put it down and you have to reread it. It's also things like calculation difficulties. Now that's just having difficulty with your facility with numbers, just finding you can't quite work things out as easily as you could previously. It's getting lost in familiar environments. You're maybe going around a roundabout and you suddenly can't remember which exit it is, or you can't find your car, not you can't find your car in the car park, but you can't find the shop or the route to get back to your car. It's things like difficulty with what we call executive function. Now that's our planning ability, it's our judgment, it's trying to plan your day. So it's the things which effectively are your thinking ability. And so difficulty with that, thought processing. And then other things are problems with language. So maybe finding it difficult to find the specific word for something, and you're just using more generic words, or you're saying the thing, or you know what I mean, things like that.
How can our viewers get involved?
All you have to do is either for yourself, for a family member, for a friend, is just to contact us.
Well, thank you so much for joining us. Such an important topic, and we'll put the information up on the screen on how you can get more information right here from Good Morning Washington.